Hello, I am Dr. Eugenio Brenes. I am the current director of Advance Dental Costa Rica. I want to take a few minutes to show you all the different protocols that we have implemented in our office in order to make the environment feel safe for you and our staff. From the moment you enter our office, you're going to see a change in the protocols of admission to our office. The first step is we have an adhesive mat which is going to help us clean the surfaces of your shoes. After that process, one of the staff members is going to help us to measure your body temperature. By doing so, we can guarantee that you're a patient that can be admitted for dental treatment. We're going to provide you with alcohol so you can rub your hands. We're going to give you some shoe covers. With that, you're helping us to maintain a clean and safe environment. Once you are in our waiting area, you will see significant changes. You will no longer see any magazines, brochures, or any objects that are meant to be touched in a public setting. We are practicing social distancing. Therefore, the only personnel who can be in the reception is our staff members and the patient itself. The maximum amount of patients that can be in that room is limited to 3. Our goal is for you to be the least amount of time in there possible, as our office has set up a goal between 1 to 5 minutes of waiting time in our reception area. You may use a mask, and we enforce and support the use of masks during the time you are in our reception area. Once you enter, we will require you to remove your mask, and then we're going to give you a special rinse for your mouth so we can decrease the amount of virus and bacteria. Because we need to be in a safe environment and we want to take care of you, we no longer can practice dentistry with this outfit. We have increased the level of protection and care in all our treatments. Depending on the process and the procedure that we're going to be doing, you will see different layers of protection. Let me explain the use of each of the layers that we're going to have. The first layer is a Tyvek suit that is a head-to-toe suit. The material is a repellent material. That suit is going to be used in conjunction with an N95 mask that will be used for intermediate consultations or intermediate procedures, such as initial evaluations or controls or checks. If we're going to do processes like crowns, bridges, dental cleanings, placement of implants, we're going to see that bump up. We're going to have the following: N95 mask, a disposable gown, a hood for our head, plus an extra set of eye protection. On top of the layers that we have prior, we're going to have a face mask. With all those layers, our personal protective equipment is on top of what the standard is required. That way, we can guarantee that all our personnel is taking care of your health and well-being. A lot of our patients had asked me, how have you bumped up the levels of protection between patients and patients? Once the patient has finished his procedure, we no longer escort the patient to the front desk. What we do is we send via software that we have invested on all the instructions that they needed to be had in our front desk in order to schedule or to have the next appointment readily available. So what we have done is we have trained our staff in 2 teams. The staff that is in the room will start the first stage of cleaning. They will use a peroxide-based disinfectant and clean the area. Then another team will come 5 minutes later, because that's the time that the manufacturer of the product intends the product to be used, and then clean the whole area for a second time. With another substance based on chlorine, we are guaranteeing that 2 different teams are cleaning the area. Regarding our air conditioning units, before this we had a protocol in which we clean every 6 months. Nowadays we're cleaning it every month and a half, so we can guarantee that the filters are in check. Also, every 2 months we are hiring an external company to come and clean the whole office. We are taking this as an extra measure. We're very pleased and happy in Advance Dental Costa Rica to have these protocols in action. Since we opened our doors in 2007, our main objective has been the well-being of our patients. And this COVID-19 has been a boost of innovation. We are looking forward to have you as a patient. If you have any questions, concerns, or fears, please contact us, and I'll be more than pleased to help you answer all of your inquiries